Now we continue with this our tuberculosis. Last lecture we seen mode of transmission. Understood mode of transmission? Now we will see here incubation period. Incubation period means here the period ranges from few months to few years depending on the host parasite relationship. How much the incubation period? It is actually depends on host parasite relationship. That is how the relationship is there in between the host and parasite, and severity of the infection. How chronic, how severe the infection is. According to that, the incubation period is there. Okay. Signs and symptoms now we will see here. Just it is same like our common cold and cough, isn't it? But if it persists, it is very dangerous, isn't it? It damages the lungs. So the signs and symptoms are same, little bit chronic. That is, we will see here a bad cough. Cough is there in the common cold, isn't it? But here, a bad cough that lasts for 3 weeks or longer. 3 weeks or longer. Chest pain or continuous chest pain, or sometimes what happen? Pain with breathing or coughing. While breathing, there is a chest pain, or while coughing, there is a pain in the chest. Shortness of the breath. Okay, because mucus secretion is there. Bronchoconstriction is there. So that's why there is a shortness of the breath. Difficulty to take the breath, isn't it? Palpitation and rapid pulse. Palpitation and rapid pulse. Weight loss, night sweating is there. Chronic cough and hoarseness of voice. Due to cough, there is a difference in the voice. That is the hoarseness. Little bit hoarseness like. Okay. Fever. In women, there is a absence of menstruation. It is the common symptom in women. Okay. Weakness or fatigue. Because due to that continuous coughing, the patient, that individual loses the interest in food. So there is a weakness, there is a weight loss, there is a fatigue. Here also we mentioned here the loss of appetite, anorexia, that is loss of hunger, coughing up with blood or mucus. While coughing, there is a presence of blood or mucus. These are all about the signs and symptoms. Understood? Signs and symptoms. Now we will see the pathophysiology. Okay. Infection via inhalation of the droplet nuclei. If the positive patient is there, if he can sneeze or cough, then what happens? The droplet nuclei is there. Okay. That these will we inhale the other patient, other individual. Okay. Infection. Why the infection? How the infection takes place? Via droplet nuclei. Via droplet nuclei. Transport of bacilli to the terminal alveoli. Where when it will enters in the individual, directly it will go to the lungs. And that also terminal of the alveoli. We know the anatomy and physiology. Okay, of the lungs. Okay, so terminal of the alveoli. Ingestion of organism by macrophages, followed by there is a multiplication with macrophages. It will go to the bacilli, macrophages, and that there they will multiply, and then these transport organism by the regional lymph nodes, transporting to the lymph nodes further by infected macrophages. With continued multiplication and minimal inflammatory response. But not showing that much response, inflammatory response. Extension of the organism. Not only they will remain there in the pulmonary or the lung in the alveoli, but via bloodstream, they will extend to the other organs, okay, through the bloodstream from the regional nodes. From the regional nodes, they are transporting via bloodstream, okay. Cell mediated immunity and hypersensitivity. What happened? Cell mediated immunity and hypersensitivity. Development then due to this causes the development of the clinical disease. Okay, either disease or either control of the infection. If this is there, what happened? Due to our immunity, we can save, we can, what we can call, due to our immunity power, we can win from that mycobacteria, okay, Mycobacterium bacilli, due to our highest power of immunity, due to our antibody response, isn't it? If there is any weak person, weak immunity, if it shows the hypersensitivity, then what happens? It develops the clinical disease. Okay. If good in immunity power, then what happens? Successful control of the infection. Okay. And reactivation or reinfection. But what happens? Sometimes what happens? These bacteria will be remain there in a form of dormant phase. They doesn't show any type of the response. But when they reactivate, it again shows the clinical response, that the clinical symptoms, okay, develops the disease. But sometimes what happens? Sometimes at that time, the individual will cure. But second time, secondary, if it will again reinfection is there, reattack is there, reattack of the Mycobacterium bacilli is there, then what happen? Again, the development of the disease will take place. This is all about the pathophysiology. Okay, understood this one all? It is all already, it is always depends on our immunity power. So that's why build our immunity power. Okay. Now diagnosis, common diagnosis are there. First of all, physical examination. When we will go to the doctor, what the doctor will see? Physical examination. Okay, by asking the medical history, by checking with the stethoscope. Okay, everything all about they will. This is all about the physical examination. Blood test may be confirmed or rule out latent or active tuberculosis by checking the blood. Okay, whether it is active or latent. Okay, radiological examination, it will come again here in the X-ray, CT scan. Okay, in the TB cases, irregular white area against the normal back, we are seeing in the X-ray, isn't it? If you will see the X-ray, then you can understand this one, white area. If more white area, that means more affected, the lungs are more affected, isn't it? Like a cotton, like this one, you can see. What we will see directly, if normal is there, we will see only the ribs and everything, black background. The ribs are white. But if we will see the more white patches like cotton in that lung, then that is the infection is there. Okay, CT scan test is done, also we can done. This is all about the radiological examination. Sputum examination, that is we will take the sputum, culture it one and diagnose the acute TB. But the sputum culture can take too much time, 1 to 8 weeks. If you will wait like that only, then the disease will exaggerate further, isn't it? So this is not that much effective. Positive tuberculin test, PPD. Positive tuberculin test, that is the PPD, that is the purified protein derivative test. Purified protein derivative test, PPD. Or we can say as a Mantoux test. What? Mantoux test. It is widely used for the diagnosis. What we will do here, the small amount of the protein derived from the tuberculosis bacteria is injected between the layers of the skin. That is the intradermal injection we will give, very dilute, and we will wait 24 or 48 hours. Within that one, if the reaction, if that one test is positive, then we will say that the patient is, the individual is suffering from TB. Okay. Biopsy, the sample is affected area, a sample of the affected area is taken out to look out the TB causing bacteria, same as that of the other. Okay, biopsy, we have to take out the sample. Okay, and that we have to check in the laboratory whether the microorganisms, whether that area is positive or not. The TB tubercle bacilli are present or not, that we will see. Infection we will check here. Okay, MRI. Lastly, what we will see? The MRI, the brain and the spine, for brain and the spine. Okay. Now see this one, this is all about the diagnosis. Physical examination, blood test, radiological examination, in that X-ray test, CT scan, sputum examination, this one positive tuberculin test, Mantoux test, biopsy, MRI. Okay. Next one, that is the treatment. How we will going to treat? If there is infection, we will go through to kill the microorganism, antibiotics. We will give the antibiotics. First line drug. That is the step. In that first line, we will give the simple one, single drug. Okay, streptomycin, isoniazid, ethambutol, rifampicin, like antibiotics we will give. And in the second line, what we will give? The drugs administered in the combination. Means streptomycin along with isoniazid, or isoniazid along with ethambutol, or ethambutol plus streptomycin. That is a combination to prevent the development of the resistance of the drugs. These bacteria will develop the resistance. To avoid that one, we are giving in combination. 2-drug regimen is there, 3-drug regimen is there, isn't it? 4-drug regimen is also there. Means at a time we are giving these 4 combination, or 3-drug combination, or 2-drug combination, to avoid such a resistance of that bacteria. Okay. Now prevention. We know the causes, then it is very easy for us how to prevent. We know due to that droplet infection, the disease is transmitting, isn't it? So detection and isolation of the patient. Stay home if the patient is suffering from this and this. Actually, that patient, that individual should be separated out. Means isolate that patient. Okay, isolate that patient means what we have to tell them? You stay in a home, that also in a separate room. Okay, everything should be different one. The clothes we have to keep away. The utensils, whatever that patient is using, that also we are keeping separately. Okay, ventilate the room. Ventilate the room. The door and these windows, proper aeration should be there. Okay, cover the mouth properly. Nowadays we are following this type, isn't it? Before that, the TB is more danger, isn't it? The TB patient, we can't save that patient, like that situation now, corona, isn't it? So same signs and symptoms are there, but it is caused by the virus, and this TB is caused by the Mycobacterium tuberculosis, isn't it? Cover the mouth properly means nowadays we have how we are using the mask, like that only. Cover the mouth properly. Wear the mask here also, isn't it? Infected patient should be treated with specific drugs. Okay, specific drugs, that is the antibiotics and other drugs are also there. The patient and the relative of the patient must be concealed so that the patient completes the entire course of the treatment even if the symptoms disappear. The patient and the relatives also we have to give. Nowadays also how we are doing now, like that only the same situation was there before in that TB. Okay, the patient, the people are very scaring to that TB. Okay, like that the situation today, Corona situation. Okay, we have to give treatment to both patient also and to relatives also. Okay, and if the patient is individual is entirely cured, then also the treatment we have to give the we have to give the treatment completely for the completely disappearance of that, because we know the these tuberculosis bacilli are remain dormant phase, that also we have to eradicate that one also. Okay, so that's why even though the symptoms are disappearing, then also we have to give the drugs for some more days. Okay, the patient should not allow to split in public places. This is the main dirty thing we are doing, isn't it? So do not split in the public places. Okay, while talking, coughing, the patient should wear the face mask, so to keep the mouth and nose covered. Okay, BCG vaccination. Now how the corona vaccination is there, this is approved one, that is the BCG vaccination. Before only the child, when the childbirth takes place, at that time only we are giving the BCG vaccination. And so that nowadays we are not scaring about this TB, tuberculosis. So BCG vaccination should be given in the newborns below 4 weeks of the age, so that due to that vaccination, the antibodies will develop and we will be safe. Okay. Risk factors may be chances of diabetes mellitus, HIV infection, alcoholism. See here, if risk factors are there, if the patient is having diabetes mellitus, that is very risky. Okay, because this infection and due to that diabetes mellitus, if in that diabetes mellitus any infection is there, it will exaggerate, isn't it? Again, this according to this, the correlations are there, isn't it? HIV infection, already the immunity power is very low, so that's why this is correlated. Alcoholism, same. Chronic lung diseases, silicosis, same. This is the risk factors. Okay. Complications now, see. Spinal pain, obviously. Joint damage, meningitis is inflammation, swelling of the membrane that covers your brain. Okay, that is the inflammation of the brain coverings. Liver or kidney problem is also there. Okay, and heart disorders, these are the complications, because the patient cannot breathe properly, so that's why there may be chances of creating the heart disorders. Okay, this is all about our today's tuberculosis. We are completed here this TB. If any problem, you ask me on the WhatsApp. Okay, we will stop here only.